everyone. I'm Barbara Ham-Lee. It happens every 10 years. It's in the Constitution, and it's used in a variety of ways. I'm talking about the 2020 U.S. Census. Census numbers determine how many seats each state will have in Congress and how much federal money will be allocated. Local governments use the numbers to determine public safety, health issues, and when to build new schools and hospitals. So why are so many communities distrustful of the census? Why do so many people decline to participate? And what are the consequences of not being counted? Up next on Another View, everything you want and need to know about the upcoming census count. Stay tuned. Another View is next.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham-Lee. It's so good to be back after the Thanksgiving break. We hope you had an enjoyable holiday. Before we begin our conversation about the upcoming U.S. Census count, we have some major news to share with you today about Another View. Since its debut as a television program back in 2009, through its transition to radio in 2011 until now, Another View has always aired on Fridays at noon. Now, this is going to change beginning Thursday, January 6, 2020. Yes, Another View is moving to Thursdays at noon beginning in January. This is a programming decision made by WHRO management to align the call-in public affairs programs, Hearsay with Kathy Lewis and Another View, to air Monday through Thursday. WHRV's newest program, Watching America with Dr. Alan Campbell, will move to Fridays at noon. So what does all of this mean? Well, if you're a regular listener of Another View, you get to hear us a day sooner. And we hope to pick up lots of new listeners on our new day, so note it on your calendars and join us on Thursdays beginning January 6, 2020. We'd love to hear what you think about that. Give us a call at 440-2665 or 1-800-940-2240. Now, the other big news in 2020 is that the next U.S. Census count. It's a big deal, so big for Virginia that Governor Ralph Northam appointed citizens to the Complete Count Commission, whose mission is, quote, to serve as a trusted voice and resource to educate, empower, and engage all communities for the purpose of ensuring that everyone who lives in the Commonwealth of Virginia is counted in the 2020 census. So we are joined today by Complete Count Commissioner and President of the Hampton Chapter of the NAACP, Ms. Gaylene Kanoyton. How you doing, Gaylene? It's so good to see you.
I'm doing well. Thank you for having me today.
So the governor put together this commission. The count is coming. Why is this such a big deal?
It's a really big deal because this is about federal funds coming into our localities. As you stated in the beginning of the show, it's going to help us with our highways, education, healthcare, everything, SNAP programs, everything. It helps with the resources that we need to have in our cities, and everyone needs to be counted.
So I've been doing a lot of reading and stuff, and they're saying already before the count even happens that African Americans, Hispanics, and poor people say, we're out. We're opting out. We're not doing this. Why marginalized communities, and what is it about the census that's making them so nervous?
Hard to count. We call them hard to count communities. And that's because they don't trust the government. They think that Big Brother is going to be watching them. And it's against the law for any census count to a person who's taking the census count to divulge any of this information. It's against the law to do that. But you might have a situation where a person lives in public housing that might have 4 people, can have only 4 people there, but it might be 8 people living in the home. So it's very important to have someone that's trusted, because it's not about the name and the address and who the person is. It's about the numbers. All this is about is counting who's living in your city or locality. That's what it boils down to. Okay. It's not about, it's not about citizenship. It's not about any of that. It's about who's living in your city. On April 1st, wherever you lay your head, that's where you should be counted.
So what happens, Doug, for people who are incarcerated or in the hospital or in nursing homes, institutions like that? Are they counted separately, or should the person where they normally live count them?
No, they're going to be counted where they are.
Okay.
They will be counted where they are, and that's what it is. They'll be counted because that's right now that's their address. They're in the hospital, right? Mm-hmm. That's going to be counted where they are. Basically, what's going to happen is that we need what a census. They have thousands of jobs. It is so important that people go onto the census website and they apply for these jobs because we need trusted voices in the community that can go there. I mean, if you go, I'm using public housing as an example. I went there and did some Medicaid enrollment, and people didn't want to go on Medicaid because they didn't trust it. They said, this is free health care. It's got to be a catch somewhere. I had to find that grandmother in the public housing to go and get them and say, look, you're going to enroll in this. These are people that we need to find, trusted voices in the community that people say, okay, fine, churches. We would like to see, one of the things I'm recommending is that churches have laptops and this is the first year you'll be able to do it online.
Yes, I was going to say that is something that's brand new.
Right.
Okay.
You can still mail it in, you can still call, but this is the first time you can do it online. Mm-hmm. So imagine if all the churches were to have a laptop or whatever, some kind of computer at the church, then people can go to church and they can just go and get counted as they leave out. They can go and just put in
go
their
to
information.
Service that morning, go over, put your information in, and be done.
Mm-hmm. And be done.
So the key number is, or the key date is April 1st.
Right.
Wherever you reside on April 1st, that's where you're counted. But how long do you have to actually submit?
Till July.
Okay.
And it ends around, there's somewhere around July is where it ends. But the reason, and let me just say this, why it's so important that we need to get people to work for the census. We need trusted voices. We need everyone to be counted. And we also, people want jobs. They're in the federal system already. So they can pivot over to another job while they're in there. So that's another way, too. And it pays well. So that's something that can help our employment.
I actually happened to just go online and I looked up City of Norfolk. And so, because wherever you are in the country, it pays differently. But for City of Norfolk, if you were to become a census counter here, it's $21 an hour.
Exactly.
That's good money.
Mm-hmm. Yeah. That's some really good money. Yeah. And you can set your own hours. But we need trusted voices. You have pregnant moms. The babies need to be counted. And people don't know that. Because once the baby is born, that is $2,000 a year for 10 years. That's $20,000 that your locality will miss out from the federal government.
So if you're pregnant on April 1st, you need to count the baby
exactly
as one of as living in your household.
Exactly, because the baby's gonna be born.
Wow, I never even thought about that. Oh my! What are some of the other questions that are on the census form?
And some of the other questions that they have on here is, for example, is this house, apartment, or is this a house, apartment, or a mobile home? I mean, it's really easy questions. What is your telephone number? Were there any additional people staying here on April 1st that you did not include in question 1? And I mean, it just kind of reinforces. They just want to know who's living in your house. They want to know that you have real people living in your house. Sometimes you have homeless people. A homeless person might be on your sofa. Then you count that person
as living in your house. But what about the homeless person that's living either in a shelter or on the street?
Right. And so that's one of the things that I know that the Complete Commission is working on right now. To see how do you count someone that's living on the street. And so we'll have some more information for that, but they will be counted. Okay. They definitely will be counted.
440-2665 or 1-800-940-2240 are the numbers to call. Do you plan to participate in the census? And if you do, call us and tell us why. And if you don't, I really would love to hear from you all because I think Gaylene would like to convince you that you need to get involved. 440-2665 or 1-800-940-2240. Give us a call and let's talk about it. So they ask you for your phone number. Did they ask you for your address, specific address or anything?
No, I don't know.
Okay.
Not specific. And you have to make sure that whoever is from the U.S. Census that maybe knock on your door, that they have a badge.
Okay.
You got to make sure that they have a badge. You have to make sure that that they're legal, because there's going to be a lot of scams out here. You're going to have people out here, just like the robocalls you get on the health insurance and everything else. You're going to have a lot of scams out here, and we got to make sure that you are working with the right person that is legitimate with the federal government.
Okay, so there will be a badge that they'll have. There'll be a bag that says U.S. Census on it. And I believe that they will be taking the information on laptops or on tablets. Is that correct? Okay.
Yeah,
okay.
they have but you can choose. You can do paper if you want to.
Okay.
If you want to call in. I mean, you have three ways of doing things, that you can do it. But the most important thing is that we want to make sure that everyone is counted. Now, gerrymandering, redistricting, poll worker interference, improper demands for identification, and lack of access to in-language voting materials are all barriers our communities face before and on election. So it's very important that, everyone is counted, because it also impacts this.
Right.
It can impact our elections as well. Like you said, our congressional districts. Everything works hand in hand with voter engagement and census.
So if someone is living in this country illegally, should they fill out the census?
This is not citizenship. It's whoever resides in that locality.
So
and that's it, period.
So we are really just looking at numbers, because that's how the Congress is set up in terms of how many people will represent a particular state based on how many people live there.
Exactly.
So if you're not counted, then you lose out on that representation.
Exactly. That's exactly right. So it's all about the person that lives in that city or locality as of April 1st. During that time of the count. And that's what we have to make sure.
So in the past, Gaylene, marginalized communities such as the African American community has been undercounted. So what kind of real consequences has that brought to the community, do you think?
A lot. I mean, it impacts your health care. It impacts programs that help the underserved. It impacts education. It impacts everything. The way we live and resources that we need. And all localities should have a complete count committee. And if your locality doesn't have one, or you don't know, contact your city manager, board of supervisors, and ask them if they have one. And then perhaps ask if you can serve and help out.
Okay. 440-2665 or 1-800-940-2240. Art joins us from Norfolk. Hi, Art. You're on the air.
Hi. Thank you for taking my call. I'm calling with two questions. One, for the training that the young lady mentioned, that for the census takers. When will the training start for it? Will it be in 2020, or has it started now? And then also, can someone do it part-time if they have a full-time job? And I'll take the answer offline if that's okay.
Okay.
Oh, that's
Thank
fine.
You.
Yeah, that's fine. First of all, if you want training, are you talking about training in terms of doing it as a volunteer, or actually, if you're doing it as if you want to get a job with them, then you can go online and you can apply. They're hiring people now, as a matter of fact. So, and training will start probably in January.
It starts in January, according to what I read.
However, but we're doing training, but you can actually, we have toolkits on our website, the Virginia Complete Count website, and I'll get the complete name, so we'll have it before the show's over. But there's toolkits on there that you can use in your communities, where you can actually educate people in your communities about the census. We have to have everyone educated on what the census is in order for it to work, in order for everyone to be counted, especially the hard to count community. And yes, you can do this part-time as well, too.
As if you have a full-time job.
Exactly.
Thanks so much, Art, for the call. We appreciate it. Daniel joins us from Newport News. Hi, Daniel.
Hi, thanks for taking my call.
Sure. What's your
I was
question?
just wondering, how is the census information tracked? Is this sent via mail, or can it also be done online? I know that a lot of people struggle with stamps and sending out mail, and a lot of people have smartphones and can easily do things online, so I was just wondering.
This is the first year that you're able to do it online. next year. 2020 will be the first year you'll be able to do it online. So yeah, you can do it online, you can call in, or you can mail it in. So it's 3 different ways you'll be able to do it.
So they will make it easy for you to make sure that you fill it out, Daniel. Thanks so much for the call. We appreciate that. What if you struggle with English and so forth? I mean, is there a place you can go to say, hey, help me with this?
Right. And there'll be resources, because you talk about also, I call them handied up, not handicapped, handied up. People that maybe cannot, blind, or whatever, or can't speak or whatever, there'll be resources there for them to be able to be counted as well.
Okay. Don joins us from Norfolk. Hi, Don. You're on the air.
Hi. Thanks for taking my call.
Sure.
I have a question about going door to door. Do you go out in groups? Do you go out in pairs? I had already seen what the pay was for Norfolk. I think it's great. But my concern is about my safety.
So normally what will happen is that you'll have, and they'll determine how it's going to happen. But this goes back to working in areas where trusted voices are. So you go where you feel, if you're going to be in an area, say for example, your neighborhood. You want to do your neighborhood. Would you feel comfortable going by yourself in your neighborhood? They'll have safety measures for all of the complete count staff that'll be working.
So you can probably decide where you'd like to work, Don, is what Gaylene is saying, so that you will have your own comfort level.
And you got to be comfortable with it, and they'll probably have folks where they'll be in pairs as well. But we want to talk about having events. Bringing people together, and seeing how you can, do. We got to think outside of the box, especially if we want to count the hard to count.
Yeah, so we don't necessarily have to go door to door. That's one way, but also to bring people together.
Exactly.
And to do it in large scale. Thanks so much for the call, Don. We appreciate it.
You're welcome. Thank you.
Okay. 440-2665 or 1-800-940-2240 are the numbers to call. We're talking about the upcoming census. So, Gaylene, President Trump had a big thing back this past summer about trying to get the citizenship question on the census count, on the questionnaire, and the Supreme Court shot it down. Any residual from that at all, or do you think that may come up again at some point?
It can always come up, but you have to realize that people are using the resources in that locality. They're using them. They're already using the resources, so they need to be counted. If they're not counted, then that's $20,000. That person is using resources they're using in that locality already. So why not count them?
So it's $2,000 per person
for every year. Yeah, so it's $20,000 per person.
Yeah,
and that's why that's a lot. That's a lot, and then and so that's why we want to make sure. This year, I'm proud of our Governor Northam for putting together our commission, because it's a very diverse commission from across the Commonwealth. And we're coming up with different measures and ways that we can really impact, the hard-to-count community and educate everyone at the same time. We have African-American calls. We have calls for the faith community. And so you can get involved different ways. But I'm also asking everyone to please, in your locality, find out if your locality have a complete count committee. And if they don't, ask them, will they put one together, and if you could serve on it to help.
Is that done through the local government?
Yes.
So, for example, you could call Norfolk City Council to find out whether or not there's a complete count.
The City of Norfolk has one. The City of Hampton, I believe City of Newport News. I mean, quite a few of the cities in Hampton Roads I know have the complete count committees. But you have a lot of other areas, I guess, across the country that have them too. But if they don't, then ask them why. And some states may not support it as well as other states. But this is about the locality. I think it's the locality's responsibility. You may not get the resources all from the state. The budgets might be tight. This is about the locality. So you want to make sure that you drill down and you get everyone counted where you live.
440-2665 or 1-800-940-2240. We're talking about the census. Have you ever become a census counter yourself? Have you ever gone out to participate? Are you planning to participate this year? And if you're not planning to participate, please call us and tell us why. Let's talk to Linda in Virginia Beach. Hi, Linda. You're on the air.
Hi.
Hi.
How are you?
I'm good. How you doing?
I'm fine.
Good.
I called in because I did work the census 10 years ago, and I really enjoyed it. But one of my things I had to count was homeless people, which is very difficult. So we went out at night onto the boardwalk and counted people. We went to soup kitchens, and a lot of people don't want to give their names. They don't have to. They don't have to give you the information. But then we tried to speculate age, race, etc., because it's very important that everybody gets counted, because that's how we get our funding from the government and for the state. I went to nursing homes and did that, but I really enjoyed it.
Well, that's great that you enjoyed it.
I hope you apply again then, because we need that enthusiasm. And and it's not only about, let me just say this to you, it's not only about going door to door, different places to count. You can also get a group of people together and phone bank and educate people to go out to make sure education is the biggest part of this whole piece.
So people really should be talking about this now.
Exactly.
Before April 1st comes along. Comes along. Linda, do you plan on doing it again this time?
Well, again, I have a full-time job, but if I could do it part-time, I would do it. And then they asked me to be a supervisor last year after I had done my initial count. But it is very rewarding to be part of something that's so important. I mean, it's mandated in the Constitution that we count how many people are living here. And again, not that you're a citizen. And to win over the homeless people were very afraid to work with you. But once they understood that it helped funding for their needs and for everybody, they were very cooperative.
I was going to ask you, what was one of the phrases or wordings that you would use to convince someone to talk to you?
That they're important, that they count in this society, because a lot of them feel like they don't count, and they do. And then once you get like a couple of them on your side, they would talk to the other ones, and they would help you get that count. And they would, so once you got one person on your side, you could get the true count, which it is very important to do.
Okay. Thanks so much for the call, Linda. We really appreciate it.
Oh, thank you. Take care.
Take
Bye-bye.
care. Have a good one.
That's great. We need that enthusiasm.
Yes, very much
because it's so important. And everyone, and she's right. The homeless, whether they're homeless, whether they're a citizen, whatever, everyone is important. And all the resources are being used one way or another in your locality.
So if someone, for example, you mentioned earlier about someone living in public housing and maybe they have 8 people instead of the 4 that are on the lease. The address is there, but there's no name, there's no number, there's nothing else to identify
the rest of the people in
right?
The rest of the people that's in their homes. No. It's not like you got to list all the people in your home. You can't do that. No. You don't have to do any of that. All they want is, to know who you are and just to know how many people in your household. And they'll ask some other questions or whatever, the ethnicity and all of that. But no, not in terms of give me the names of everyone in your household. No, it's not going to happen.
Is there anything new about the ethnicities this year in terms of the questions that they're asking?
Well, I think one of the most important thing is that it's going to be in their language. It's going to be more, and we're going to have more materials that will be in their language. I think it's also going to
be more
in
terms of Spanish,
or whether it's Japanese
or Korean, or whatever.
Yeah.
Okay, so for all different languages,
and we need to make sure that we have people from those communities as well, from those demographics as well, that would sign up to work.
Why is it so hard to get people to sign up and become census workers?
I think it's an education piece of it, and I think a lot of people feel like Linda she said it was rewarding, and it is rewarding. But some people feel like, well, I can't go door to door and I can't do this, that, and the other. But there's so many different ways that you can participate, with behind the census.
So people really need to think about more so about how they can gather their community together to do it together as more so than that one-on-one, going door to door.
Yeah, you want
type
to
of
talk.
thing.
You can hold forums, training sessions. You could partner with other organizations, get involved. And I mean, many of the organizations are already, I know the NAACP, and I know that you have other sororities, fraternities, and they're all getting involved in it. So if you're in an organization, partner with other organizations. The education piece is very key to make sure that this hard to count community and everyone is counted.
If you're just joining us, we're talking about the upcoming 2020 U.S. Census count with Virginia Complete Count Commissioner and President of the Hampton Chapter of the NAACP, Ms. Gaylene Kanoyton. So, Gaylene, you are involved in so many things, and the other piece that you're truly involved in is the marketplace.
That's right.
And healthcare. I know that the 15th is the deadline this month. If people are buying healthcare through the marketplace, you want to tell us about your upcoming event?
Yes. So December 7th is the deadline for Medicare, and that's for everyone that's 65 and over that's on Medicare. Okay. December 15th is the deadline for the health insurance marketplace. And that's the deadline. And Medicaid, since it was expanded, is all year round.
Okay.
So let's get the dates right. Medicaid is all year round. So at the end of the health insurance marketplace, I host a 2-day Enroll Fest. And it'll be at the Hampton Roads Convention Center, December 14th and 15th. And people will be able to come in and they'll be able to renew or enroll into the marketplace. And if they don't qualify, they make $17,000 and under, then they can go on to Medicaid. And we'll have people there.
And they can sign up for that all year long.
We'll have people there to start the process for them. We're also going to have forums. It's going to be a public health forum. We have our Deputy Secretary of Health and Human Services for the state of Virginia, which is Marvin Figueroa. We're going to do public health forums with Dr. Newby is going to be there.
Dr. Keith Newby?
Yes, Dr. Keith Newby is going to be there.
We know him on Another View.
Right. He's going to talk about the heart. He does a great job when he talks about the heart. Yeah. We're going to have the Hampton Proton Beam to talk about cancer updates and what the Proton Beam is doing over there. We're also going to talk about healthy eating, which is done by Dr. Newby's sister-in-law, and she's Dr. Newby as well, too. We're going to talk about maternal health. We'll have Kendra Sutton-L with the birth justice and maternal health advocate, because we have so many African-American women that are dying on the tables, having birth. And then we're going to also have a mental health trauma forum. And these are all like 30-minute sessions.
Okay.
And then we're going to have a parenting of kids that went through trauma, and that's 30 minutes. But the one thing I'm excited about is that we're going to have an climate and environmental health forum.
Oh, wow.
And we have Reverend Lennox Yearwood, who's with the CEO of the Hip Hop Caucus,
As
a
matter
national
of fact,
figure.
We have a story about him at the end of the show today.
Okay, good. Well, he's coming in. We have Kendall Crawford. She's with the Virginia Interfaith Power and Light. We also have Karen Camlin with the Virginia State NAACP Environmental Justice. And we're going to talk about the Regional Green Gas Initiative, energy efficiency. We're going to talk about air, clean air, water, and how does all affect your health? Because it all works together. And we got to start talking about that. Because, see, our generation, and I know we're all seasoned millennials.
Exactly.
Seasoned
millennials, I like that.
Our generation, we fought for civil rights. This generation is fighting for existence. And so we want to make sure that everyone is educated on it, on what's happening in our community. We're also going to have free flu shots. The Virginia Department of Health will be there. We will also have free AIDS testing. We'll have a ton of resources, but we also will have DMV will be there to issue the real ID that everyone must have in 2020 in order to get on airplanes and everything else. You just have to bring the documentation, but we'll have that. So that'll be on Saturday from 10 to 3 at the Hampton Roads Convention Center in Hampton, and then on Sunday from 11 to 2 at the Hampton Roads Convention Center, and it's all free. Then we'll have it there. And you can go to celebratehealthcare.net and get some more information, or you can go to our Facebook page, Celebrate Healthcare.
Okay, fantastic. Yeah, you've been doing this for quite a while.
It's our 6th year.
How is the marketplace doing? I mean, in terms of people buying healthcare and how are we doing?
So, excellent. I mean, I think that in terms of the people who needed to be helped are being helped, especially with pre-existing conditions. I do want to encourage everyone to know that what the marketplace is and know that it's legitimate and not pay attention to all of these signs out here to say Obamacare, these calls that your robocalls that you're getting. These are not the marketplace. These is what we call the skinny plans. And then people they think they're in the marketplace, and by the time they get to the hospital, then they find out they're not covered.
Right.
And so you want to make sure that if you're in a marketplace, you're in a marketplace. If you're on Medicaid, you're on Medicaid, and don't pay attention to all of these robocalls and these signs that's out here. And that's why we have trusted people that'll be at our event to enroll. The reason why I started this, because I knew that if we got a lot of people into the system, that it would be hard to repeal and that a lot of people would be helped. And it has helped. I can tell you stories and stories and stories on how people would come in because they needed health insurance. If they didn't get an operation in a few months, that they would die. And then they will come back and says, I have my health insurance and I'm still walking around. You can go on my Facebook page, Celebrate Healthcare, and look at the videos and see the stories that how this has helped people.
And it's really made a difference. So, I noticed that each year there's less and less promotion of the fact that you need to sign up and that you need to renew, outside of if you're already in the system and you're getting emails and so forth. But when it first started, there was this plethora of, every time you turned around, there were commercials and so forth. And those who want the Affordable Care Act to go away, that's part of the strategy.
It's part of the strategy. If they want it to go away, just don't talk about it. And that's why we talk about it all the time. And I say go to healthcare.gov to learn. You can go to coverva.org to learn about the Medicaid. And another reason why I started these Enroll Fest, and we go all over the region, is to also educate people that fell into the gap before we expanded Medicaid on why they needed to go vote and why they needed to know who their legislators were. Because they needed to call their legislators, say, look, I need you to vote for Medicaid, to have Medicaid expanded. And we had thousands of folks that would come in that didn't qualify to go into the marketplace or didn't qualify to go on Medicaid. So when Medicaid expanded back a couple years ago and we were able to enroll people into Medicaid in 2018 to start in January of 2019, it was so rewarding because I was able to call those people back and say, now you can enroll. Now they ain't believe me, but I would say, just come on in, but you can get enrolled. But it was really rewarding because we educate healthcare. Health insurance is so important. The preventative care at no charge on any health care. Medicaid is just as good as any other insurance, your employment insurance and everything else. Preventative care where you don't pay any copays for your mammogram, your physicals, your colonoscopies, everything. We'll have a much healthier society if everyone goes get checked ahead of time.
Gaylene, you're the president of the Hampton Chapter NAACP. You're very involved in the organization on a national level, and that organization has been, at the forefront of civil rights since its inception. How do we get people to start trusting again? I think because in every instance that we've talked about today, from census to, voting to healthcare to, people just don't trust anymore that what is said is true, and that their participation matters.
Well, you can't talk about it; you got to be about it. And if you're not engaged and you don't hold your legislators accountable or your council people accountable to what they say, then you're not doing your job because you voted them in. Or if you don't vote and you talk to people who say, I don't trust and I don't want to vote, then you need to have relational conversations. For example, what's important to them? For example, if you're on a SNAP program, if you're on Medicaid, what if that was to go away? If you don't vote, it could go away. Everything, your vote is your voice. And if you don't step up, then it will impact you and impact your lives and your family.
Because we were saying before the show, we're at one point we used to say a lot, we have to vote because our ancestors died for this right, and so forth. That's not resonating.
That's
with
not
young
resonating.
folks.
What resonates with us, we know people died. We standing on the shoulders of, people that fought for us. Yeah, that's great. And we get it. But this generation, and people who are on hard times, they were like, that doesn't mean anything to me. So you have to talk to them to what's important to them and the needs and the services that are helping them. If those services were to go away, if they don't step out and vote, if they don't hold their legislature accountable.
But even if we have to have these conversations with them, and I hear you, is it our institutions? I'm talking specifically about the African American community now. Our institutions, our NAACPs, our churches, our urban leagues, and so forth. Okay, that's one level, I guess, of our community. But if people are busy, or people working 2 jobs, or they're trying to figure out where their next meal is coming from, and so forth, how do you even get to them to even have that conversation? In other words, should our churches be doing more? Should we be talking about this more so than perhaps we're talking about saving souls and, going to heaven too? I mean,
exactly.
You know what I'm saying?
It's everyone's responsibility. It's not one person. It's not one organization. It's everyone. If you're passionate about voting and you talk to someone, your neighbor or someone in your community that don't want to vote, then it's your responsibility to find out what's important to them and things that affect them. And then you can turn it around and tie it back to why they should vote.
Yeah, because voting is the key.
That's the key.
440-2665 or 1-800-940-2240 are the numbers to call. Join our conversation. We're talking about how to get involved, how to stay involved, particularly with the census coming. How will your vote or your count, why your count is important. We need to hear from you. 440-2665 or 1-800-940-2240.
And I also want to add that at the Enroll Fest this weekend at the Hampton Roads Convention Center, we're also going to have a job fair. The Hampton Roads Workforce Council is a big partner for us as well. And they have
formerly
a ton
Opportunity
of
Inc.
Formerly Opportunity Inc.
Yes.
They have a ton of resources. And so they will be there, and we'll have employers there, so you can come and look for a job, learn how to write a resume or get help with writing a resume. And we'll have HR CAP is going to be there, the Community Services Board. We'll have public housing will be there as well. So it'll be a ton of resources that will be there for you to come.
So this is truly for everyone.
It's for everyone. It's for everyone. If you already have insurance, you're looking for a job, or you're looking for free resources, or you need to have a test done, health screening is going to be done there as well. We're going to have Hampton University students there. There's a nursing department, and some other health professionals will be there as well. We'll have some a couple of the schools, the colleges will be there. That offer classes in the healthcare field, because you don't have to be a doctor or a nurse. You got to learn how to coding. Career Institute will be there. How to code, and there's a ton of jobs.
Different type jobs.
Yes, a ton of jobs.
And the other jobs are those census jobs.
And those census jobs, please.
I'm just amazed that so many of those jobs are open.
Oh
still,
my God, it's still a lot of jobs open. We're trying to fill them, and not only in Hampton Roads, but across the country.
Yeah, I'm trying to find the website that it's the U.S. Census Bureau. If you go, I think it's uscensus.gov.
Right.
Is that correct?
Right. And you can also go to our commonwealthvirginia.gov /complete count. You can go to that.
There you go. Yes.
That's ours. And then also you can also go to the census website. You can go to the USA.gov website too and type in census, and it'll come up.
The jobs are out there. It's up to you to get involved. 440-2665 or 1-800-940-2240. Claudia joins us from Suffolk. Hi, Claudia. You're in the air.
Hi. I was just curious if Virginia was a Medicaid recovery state where they try to get the money for whatever bills a Medicaid patient has incurred.
So, for example, if you go into Medicaid in the last 3 months, you're talking about incurred while you're on Medicaid?
Correct.
Okay, not yet. But they do have resources to help you with that. but we're not recovered.
Okay.
We're not the recovery. Well, look, we just got Medicaid expanded, and that's a great
Right.
feat. Now we move on to the next level, but there are resources, and Medicaid even have resources to help you with that too. If you go to coverva.org.
It's not for me, but I've read articles where in other states, they are Medicaid recovery states, and they're bankrupting people because they used Medicaid.
No, that's not.
Even after they come off, even after they get a job and they come off of Medicaid, they're coming after them after that to repay whatever services or bills they incurred.
No,
does that make sense?
Cover VA. I don't know what they're doing in other states, but I can tell you that in Virginia they are very compassionate and they are working with everyone. And I doubt very seriously that anyone would be bankrupt. We have a governor that is very passionate about health care and very passionate about everyone having health insurance. So there are resources. If you go to coverva.org, you can look at those resources. If you know someone is in trouble, that's incurring fees coming off of Medicaid, and I don't understand how that might work. That doesn't sound right. I've been working with this for a long time. This is the first time I actually heard someone that was penalized this way. So I just say call coverva.org.
Check out other states. It's but even employer sponsored healthcare we can barely afford it through my husband's work. So
right. Well,
something's got to happen with healthcare.
That's a whole nother conversation. And I think that in Congress, and they're working on that and trying to fix certain things or whatever. But it boils down to the insurance companies, and I believe that that our Congress and our legislators, they'll get that fixed.
Claudia, let me ask you real quickly. I understand that you used to be a census worker also. Is that correct?
I am. I just finished. We just finished doing address verification at the beginning of October.
Good.
So I've already been out and about in Suffolk verifying address blocks. And please tell everyone not to fall into the White House's trap and scaring them into
right.
We take an oath. Even some people piped in, to our grave, we are not allowed to disclose any information, and somebody added, and beyond the grave, that we are not allowed to divulge any information. Don't let them fall into the trap of distrusting us, because we are there like I said, we take an oath where we cannot divulge any information. Don't fall into the trap and be undercounted, because it's money to the localities.
Fantastic.
And you're voting. So, and like I said, I'm also an election officer, and Suffolk bends over backwards to try to get everybody to vote.
Well, you're just excellent.
She's very active.
She is the perfect example of what a citizen, of what a resident in your area should be doing.
Exactly. That is fantastic.
They're great people. I had a great supervisor, and ready to get back out there and start on it again. So tell everybody, the marginalized communities, not to fall into that distrust trap.
Fantastic.
It's going to make our job more difficult when that stuff gets out there. It's like, no. I've already had discussions, on the Ring doorbells. Mm-hmm. They can talk to you.
Oh, yes. Uh-huh.
So they're like, oh, but you could just be there to rob us. I'm like, no. Look, here's a picture of my badge. I'm the real deal.
Now, Claudia, do you go out by yourself?
Yes, I do.
Okay,
but if you have any issues, you can call your supervisor, and more than likely they'll go out with you or send you with somebody else.
Yeah, we had a caller earlier who was concerned about going out on her own. So thanks so much, Claudia, for the call. We really appreciate it, and thank you for being such an engaged citizen. We love that. Thank you.
All right, have a good day.
You too. Take care. Bye-bye. So we only have about 5 minutes left. So what do you want to tell folks in terms of the census?
I just want people to make sure they do their research and get the correct information. It's going to be a lot of noise. It's going to be misinformation it's going to put out there. It's going to be fear tactics, and just be aware of that. The most important thing is for us to keep our eye on the prize, that everyone needs to be counted, because it's only going to help everyone and you in your city or your town, that that you'll be able to have the resources that you need to live. And so that's what it boils down to.
And if you're involved in a community group or a sorority or a fraternity or whatever, where can you go to get information so that you can hold informational sessions and so forth for your constituents?
You can go to our website, which is commonwealth.virginia spelled out .gov/complete count.
Okay.
And then also we have an email address, which is Virginia Complete Count @governorspelledout.virginia.gov. You can Google it. I mean, it's easy to find.
It's very easy to find.
It's very easy. But the toolkit is awesome, and I just recommend that everyone get with their faith community and just partner and really get the education out.
Okay. Do we have time for one more call? I think we do. Matthew joins us from Hampton. Hi, Matthew. You're on the air.
Well, thank you, Barbara. I love your show.
Thank you. You only got about 3 minutes. What's your question?
Great. Hey, I'm the executive director of the health clinic in Hampton. We're part of the Virginia Safety Net for free and charitable clinics. So
Okay.
I just wanted to make sure that, like your last caller who said that they're struggling to afford their employers' paid private insurance. There are plenty of clinics. I think there's almost 60 statewide that offer subsidized or free care for folks who are at or below, I believe the marker is 300% of the federal poverty level now. So there are places that people can go to get affordable health care, even if they don't qualify for Medicaid.
Wow, that's fantastic.
You got the Southeastern Virginia, and they'll be at our event on Saturday, our health system. And then you also have the Hampton Roads, health system. You have several places.
So can you just Google, where I can find help with my insurance?
Community health centers.
Kind of thing?
That when she asked the question, it made it sound like I thought she was going there. That's why I didn't understand when she went to get a job. Why would she have all these bills? So I think it's all kinds of different situations.
Okay, Matthew, thanks so much for the call. We appreciate it and giving us that information. Thank you. So now the Enroll Fest. December the 14th and 15th.
That's right.
It is free, open to everyone at the Hampton Roads Convention Center.
In Hampton, Virginia. That's right. You can call 757-287-0277, 757-287-0277 if you have additional questions.
Okay. Gaylene Kanoyton, thank you so much.
Thank you. This is great. I always enjoy coming on the show.
Absolutely. And we will be right back.
Hello, this is Spike Lee. What's happening? And you listen to Another View.
And welcome back. There's been a lot of talk about climate change, but I'll bet you have not heard it expressed quite like you're about to hear. A group of talented performers and community activists recently came together in Norfolk to address the issue of climate change. And as our Lisa Godley found out, the event was part of a movie production that uses comedy and culture to shed light on the climate crisis.
There's an area that's just like New Orleans. As a matter of fact, most of America call it ground zero for the climate crisis.
Reverend Lennox Yearwood Jr. is talking about Hampton Roads. That's why Yearwood, who goes by the name Rev, recently brought his talented group of performers and dedicated community organizers to Norfolk to perform their show, Ain't Your Mama's Heat Wave, at the Addicts Theater.
And hopefully one day we will say that we are fossil-free at last. Fossil-free at last. Thank God Almighty, we are fossil-free at last.
If a Category 1 even, a storm hits this area, it can have double the impact of what Hurricane Katrina did to New Orleans. Not only is it dealing with the crisis because of the sea level rise, but also because Norfolk itself is actually sinking. So you had this double crisis that was happening. And also because you had the same economic disparities, the same kind of housing complex that are close to downtown, like the North Ward was for the French Quarter. You had that with St. Paul's area. So you have this almost the exact same situation in a very eerie way, and even worse, because at least in some cases in New Orleans, there was more ways to get in and get out. In some cases in Norfolk, there's only one way in and one way out.
Yearwood, a Louisiana native, is also the president and CEO of the Hip Hop Caucus, a nonpartisan organization that encourages young people to participate in elections, policymaking, and community service. Rev says, according to the UN's Intergovernmental Panel on Climate Change, we've got a little over a decade to make changes in regards to the climate crisis. He's so concerned about the timeline that he's championing the cause by trying to get as much information as possible into the hands of those he feels need it the most. And he's bringing it through entertainment and one-on-one conversations.
The flooding will continue, the wildfires will continue, the droughts will continue. All of those things that are hitting particularly vulnerable communities and communities of color first and worst, those things will continue and grow to the point that we won't be able to change it unless we transition from fossil fuels to clean energy.
Terrence Muhammad, who goes by the name TC, is one of the community organizers on the ground helping to spread the word. But he says what's even more important is listening.
When we talk about climate change, you're talking about housing and where will people live in these crises. You know, when people are talking about there's a hurricane coming, you need to leave, you need to evacuate. The hurricane's coming on Wednesday. Well, I don't get my check until Friday. How can I evacuate? How can the churches that are a pillar in the Black community be utilized as places to help give resources, to help move people when these things happen? So part of the organizing is giving the story to them, but also hearing the stories of the people that are marginalized in vulnerable communities that sometimes don't have a platform to speak.
In addition to getting out into the community, Yearwood and others who make up the cast of Ain't Your Mama's Heatwave use cultural expressions and political experiences, music and comedy to bring people together and start a dialogue about the toll sea level rise is taking on our communities. Rev says their goal is to generate impactful conversation, not just in Norfolk, but for the entire country.
We want to make sure that people know that this is the human issue with a standpoint that, listen, let's deal with the facts. Climate crisis is real, and we must now educate and energize people to deal with that fact. Let's laugh a little bit, but then use that laughter, use that fun, as we do in our community, to make sure we go out there and make change happen.
For Another View, I'm Lisa Godley.
And if you'd like to hear Reverend Yearwood, see him in person, he is going to be at Enroll Fest on Saturday, December the 14th at 2 p.m. So go on over and check him out. In case you missed the top of the show and missed our grand announcement, I'll make it again. Another View is moving to Thursdays at noon, starting on the 6th of January, 2020. Lots of changes coming in 2020. This is a WHRO station management decision to put all of the talk shows back to back. So that is Kathy Lewis from Monday through Wednesday, Another View on Thursdays, and Dr. Alan Campbell with Watching America moves over to Fridays at noon. So please mark your calendars. Make sure you stay with us. Those who have not had the opportunity to listen to us on Fridays, we're hoping that they will bring them along on Thursdays. And those of you who are so used to us being here on Fridays, come on over to Thursday, and we're still going to rock and roll as we've done for going into our 11th year. So that is fantastic that we've been on the air that long. And I want to thank you so much for spending an hour of your life today with us. If you'd like to hear this show again or share it with a friend, please visit our website, anotherviewradio.org, and download the podcast. And while you're there, you can sign up for our eView newsletter. It's a once-a-week reminder of upcoming shows. We're on Facebook, Twitter, and Instagram, so check us out. Next week on Another View, the Another View Roundtable, with thoughts on whether St. Nick will leave a present or coal in our stockings when it comes to race relations. Our theme music was composed and performed by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer. And Lisa answered our phones too. I'm Barbara Ham-Lee. Make it a fantastic weekend, everyone. And thank you so very much for listening to Another View.